Hey, yeah, how you doing? I want to have a rant, and I want to have a rant about a couple of things. Uh, the first of which is to do with America, the second of which is to do with here, and the first of which is about the sexual assault accusation against Joe Biden. Um, so if you don't know, Joe Biden, a former staffer of Joe Biden's when he was senator for Delaware, has accused him of sexual assault. She accused him of digitally penetrating her, sorry. And this hasn't been widely reported, although a few people have sort of talked about it. And I'm not going to go into the case all that much because I don't have enough information. I'm more going to go into sort of hypocrisy that I've seen from some of the people who are talking about this. And the first one is Howard Dean. So this reporting came from The Intercept by a guy called Ryan Grimm at The Intercept, who I think is a great reporter. But he said this, and he said in a tweet, and I've got it here. This story may or may not be true, but it's from The Intercept, which is one, often not credible, and two, was started by Glenn Greenwald, who helped Assange and Putin undermine the US election. I tend to believe victims, but sceptical about sources like this. They are the Fox News of the left. And Howard Dean is the governor of Vermont who said that. And firstly, I think that's just wrong. The Intercept has never had to retract a story like that. But I think the hypocrisy comes from back when the Kavanaugh hearings were going on. Howard Dean tweeted, "I think the court of public opinion is what counts. I believe Dr. Ford, and I think most Americans believe Dr. Ford, not a professional politician, which is what Kavanaugh is." Hiya, James, how you doing? Oh, hi, Kit, you're on there as well. And the Christine Blasey Ford case was first released by Ryan Grimm at The Intercept, who's who's the same person who has brought this case forward. And all the things that people on the left say about Republicans when they are accused of things like this, accused of sexual assault, sexual harassment, stuff like that, are coming forward from Democrats now. Things like why now? Why come forward now? And looking into her politics and saying, is that relevant, and all the rest of this stuff. And it just proves the point. I think that I've got a quote from Arwa Madawi, which is who's from The Guardian. I think she says it best. It's about the Me Too mantra. She said, "The Me Too mantra, believe women, doesn't mean that women never lie. It means that our systems of power are biased towards believing men never lie. It means that it takes decades of allegations and scores of women coming forward for powerful men like Harvey Weinstein, Jeffrey Epstein and Bill Cosby to be brought to justice." And I think that's exactly right. And the Me Too thing is encompassed by the Time's Up organisation. The Time's Up organisation is who she first went to with this allegation. It was just a sexual harassment allegation. Then she came forward after Laura Flores accused Biden of sexual harassment, of sniffing her hair and kissing her neck without her permission. That was before a rally that she did. And she went to the Time's Up organisation. The Time's Up organisation refused to use their Victims Defence Fund, which is specifically set up to help women who have allegations about rich, powerful men, because they say going after someone who's running for federal office might affect their status as a non-profit. And I think that's dubious at best, because as long as they're consistent with their mission statement, I don't think there's any law that says that. It's just they can't be biased against political candidates and things like that. So I think that's dubious at best. And I'm not going to suggest any sort of conspiracy. I just think it's worth pointing out that the PR team for the Legal Defence Fund is SKD Knickerbocker, whose managing director is Anita Dunn, who is Biden's top advisor for the Biden campaign. And I've got a quote from the Time's Up Legal Defence Fund website, which says, "This fund this is a quote from them, "This fund helps workers connect with lawyers and bring cases of workplace sexual harassment and related retaliation regardless of industry, rank or role." So, obviously in this case they've decided that is irrelevant. And so I really think that even just as an electoral thing, Trump's going to bring this up. He's definitely going to bring this up because we have for ages talked about problems of sexual assault, sexual harassment, things like that in the White House, which is absolutely valid. We talked about it in the case of, what was that guy's name who was running for office, who Doug Jones beat? Whatever his name was, we talked about it with him. I can't remember what his name is. And now we're doing exactly what we accuse Conservatives of doing when it's someone on their side. We're playing politics rather than taking an accusation seriously. And it's not like she could be lying. I don't know. I don't know. It's more that then what you should do is all the mainstream media take their resources, see if the story's credible, and then bring it forward. But they're not. They're just ignoring it. So there's nothing really they can do. And I believe Tara Reid at the moment, and I think Biden sums up exactly why, because he said about the Christine Blasey Ford case, quote, "For a woman to come forward in the glaring light of focus nationally, you've got to start off with the presumption that at least the essence of what she's talking about is real." And I think that's exactly right. So I believe her at the moment, and I'd like to see more, just more said about this and more given to it. And also on the source thing, I don't know what, there's an interview she did with Katie Halper where she goes deep into this. I'm not going to go into exactly what she accuses him of doing because I don't know. This is Joe Biden, Giles, not Bill Clinton. This is a recent accusation by a woman called Tara Reid, and you can see exactly what she's accused in an interview she did with Katie Halper on the Katie Halper show. And she works for Rolling Stone, so that's that. Other people can look into the validity of this. I just don't like the hypocrisy of it from the mainstream, even MSNBC, CNN, CBS, all that. There's no mention of this. I think Yahoo News is the only person I've seen bring this up outside of right-wing media and progressive media. So that's all I have to say on that. I believe Tara Reid at the moment. The other thing I want to talk about is something I've got. This is about the NHS, about coronavirus, and it is about their new discharging pathway. This is reporting from Stephen Kahn, 999 Call for the NHS, and it's worth reading. I'm going to sort of paraphrase what the thing is and add a bit to it, but it's worth reading the article, which is 999 Call for NHS.org.uk. It's on there. Those nines are numbers, not letters. So their new Corvid-19 discharge service requirements issued last week to foundation trusts and other NHS England management had one clear message, which was to get beds empty by the end of the week, and the end of the week was 27th of March, so last Friday. And it's 15,000 beds they want empty in hospitals. And the model they're using to do this assumes 95% of people can go straight home on discharge, so that's 15% on pathway 0. That's no additional support, just fuck off, essentially. You're not allowed here anymore. 45% on pathway 1, which is with some sort of support care package. It doesn't really go into what that is. And 5% who require residential or nursing home setting, which is pathways 2 and 3. And then 1% of those require being in a nursing home. So that's people who haven't got coronavirus. That's people with other issues. They want to get them out of hospitals, so they've got enough beds for people with coronavirus. And overall, that sounds like a relatively sound strategy, but they haven't put anywhere near enough thought into how exactly they're going to do it. And one of the main things is, for those 1% who are leaving hospital, they've had a life-changing event, they've been in a car crash, or they've got terminal illness or whatever, they're leaving hospital and going into nursing homes or care homes. There's no required testing for coronavirus. So they're potentially going to bring people who are in an environment where you've got people with lots of viruses, taking them into an environment with scores of old people, which sounds like a bollocks idea without testing. So you know, that's great. And this is at a time when NHS staff are buying their own masks from Screwfix because they haven't got access to the PPE equipment and things like that. So how they're going to care for these, you know, these people in care homes and bring this on, I just don't know. It just seems ridiculous. What else have I got to say? I wrote some stuff down. Oh, that was it, yeah. This is happening in some ways because of a lack of beds in general. And you've got field hospitals now being set up in Birmingham and Manchester and London. I think the London one's at the Excel Centre. And yeah, that's similar to what they've done in Italy and Spain so far. And that's, you know, great unless you live rurally, in which case all those community and cottage hospitals that have been closed and sold to developers to build luxury flats might have come in handy. But, you know, it seems like, well, you might say to me, well, we're in an unpredictable crisis, you're never going to have enough beds at one point for a pandemic. I think, well, maybe that's fair enough, but in June 2019, the CEO of NHS England, Simon Stevens, said in a presentation to the NHS Confederation that the cutting of beds had, quote, gone too far. That's in June 2019 he said that, and that's odd because Simon Stevens is the guy who crafted the 5-year forward view for the NHS, which essentially mandates those cuts in favour of, quote, care in the community and moving healthcare closer to home. So their coronavirus response is essentially just to do what was in their plan anyway, which is, you know, removal of hospital services, and care in the community has gone terribly. So, you know, but it's a strategy that he proliferated for ages when he was chief executive of United Healthcare, which is the #1 health insurance provider in the US. It's moving towards a US-based system slowly, and they'll never remove the NHS by name because it's too beloved. But they're slowly going to take away bits of it by, you know, doing this care in the community stuff. And I have a question really, which is, after this, you know, this is going to all completely change the way we think about healthcare, the way we think about politics in general. It won't be the same after this. I don't know where we go in terms of the NHS from here, because like when Trump was talking about potentially including the NHS in any sort of trade agreement and everyone was up in arms because people really love the NHS because it's fantastic, or at least the principles in which it works by are fantastic. This is obviously bigger than that, so will that renewed favour, you know, people are out in the streets applauding the NHS, so it's on Friday night they were out, you know, 8 o'clock I was out there as well, just applauding NHS workers and things like that. Will that renewed trust in the NHS allow people to recognise that the integration, as they call it, is and the allowing of providers to set service limits and things like that is, will they recognise that it's moving towards a private healthcare system in all but name? I don't know. That's all I wanted to say really. I wanted to have a rant because I can't be in the pub and have a rant, so I've had one out here. So sorry you had to watch that. See you later. Bye.